We didn't think we'd be here again so soon. We didn't think we'd be here again dealing with such extremist public policy. It's hard to even call it public policy. In finance, for the past couple of weeks, what we've been talking about, and maybe some of you saw our television show. Oh my goodness, a surprise a day in the General Assembly. And yesterday, what we were given was a reinforcement of certainly what we've all talked about as the defunding of Planned Parenthood and community clinics. But, you know, what we need to understand is the General Assembly had this wonderful opportunity this year. We had an opportunity to craft a budget, as Senator Turner said, to give health care to more than 275,000 Ohioans who are hard-working, low-income people who just want to be healthy and show up for work. We had this opportunity to do that, and we still continue to have a budget that doesn't have that Medicaid expansion in it to be able to do that. We had an opportunity to save women's lives through breast cancer screenings, through cervical cancer screenings, through the provision of a pregnancy test to say, guess what? You're pregnant. Now, do you want the name of an OBGYN to follow up? Because that's what I did when I worked in a rural community in Pennsylvania a number of years ago. It's okay. 28 years ago. I have no problem with that. That's how I found out, and thousands of women every day find out that that wanted pregnancy has arrived. And that now it's time to go on and have access to that prenatal care so that they deliver a healthy baby, so we can start chipping away at our horrific numbers when it comes to our infant mortality. Ohio is way higher on the top of the list than any of us would like to see. And if a woman chooses to make other choices, notice I said choose and choice twice in the same sentence, she has the ability to make a decision, to gather her family, the person that she loves and trusts, her physician, and make a decision. But that's not in the budget. That part of her decision making is not in this budget. This budget is about family planning. Planning your family. Being in those community centers. And what's happened, so everyone understands, is our budget now says Planned Parenthood, all these community centers in rural, sometimes some rural areas, the only providers of this kind of needed health care. You've been scoring high. You have been achieving at the top, and you have been reinforced by getting those grants and getting that funding, because not only do you provide quality health care, women trust you, and you happen to be able to score high on that grant application because you're doing the right thing and you're doing good work. You're keeping women healthy. Well, as my grandmother said, sometimes when people don't like what's going on, it's not a fair playing field. And so they put their finger on the scale and they tip it. And that's what's going on in this budget. The hand of people who are not concerned about women having healthy pregnancy outcomes and healthy cervical cancer screenings are putting their finger on that scale and tipping it in favor of organizations that just don't provide, are not able to provide the same kind of care at the same kind of level, and have been applying all along but never winning. And so now we've changed the rules of the game so they can win. Well, that's not fair. That's not right. And that's not the kind of public policy that I want to support. So we have a budget right now that is anti-woman, anti-poor people, and really we're not addressing the needs of those who need the care and healthy outcomes the best. It's like, you know, Women's lives and access to quality health care continue to be this political football. It's the football of choice rather than real policies to help real people. And don't get me started on what we heard yesterday, because it was just yesterday, that now, I gotta read it because I can't even, gateway sexual activity. In the wisdom of some of our members, they have decided that in this time when we need good jobs, when we need to make sure that we have quality education for our children, when we want to see Ohio be a welcoming state that has economic growth and development, is really on the cutting edge of everything. We're modern. We want to attract young people from all over the country to come and live in Ohio. Well, somebody decided to introduce an archaic amendment into this bill, gateway sexual activity. We're not quite sure what it means. All we know is there's a fine of $5,000 if you somehow make a mistake when you're doing comprehensive sexual education and you make a mistake. You could be fined $5,000. I don't even want to think about what's next. And we all know that abstinence-only programs are not effective. The most effective programs for our young people, the most effective way to prevent unwanted pregnancy is comprehensive reproductive health care. And that's what we need to continue to fight for. And I got to tell you, Senator Turner said it, we've got to pay attention to who's making our laws. Who's voting for you? Who's representing you? Do they really share your values? We need to be very sure that they do. Thank you so much for all the work that you do.